Hello and welcome to Health Digest, the program that brings to you news, analysis, development, and everything that concerns your well-being. I'm Ogom Ezedibo. A few months ago, Nigeria took another decisive step in strengthening its immunization system with the launch of the integrated campaign for measles, rubella, human papillomavirus, polio, routine immunization vaccines, and neglected tropical disease intervention. The immunization campaign, a nationwide effort targeting millions of children and to curb the spread of contagious vaccine-proof diseases. The campaign, led by the National Primary Health Development Agency with development partners, aims not only to protect children from measles and rubella, but also to integrate other services. Thank you so much for joining us on the program.
Good morning, Ogom. Pleasure to be here.
You begin by getting an overview. Why integrated campaign?
I think the essence of integrating the campaign is really just a deliberate effort by this government to be responsive to the needs of people. You know, we have received a lot of questions that says, why this vaccine, why that vaccine all the time, when we have a more comprehensive set of needs. When I have malaria, I don't get free treatment. When I, have measles, I don't get the vaccinated as much as I get vaccinated for something like polio, for example. So what we did was to then target 106 million Nigerian children and young people with an integrated suite of interventions. The measles rubella campaign, human papilloma virus, HPV vaccine for adolescent girls, malaria seasonal chemoprophylaxis, which is treatment prevention, for malaria in areas with high burden, some nutrition, even in some states that still have a high burden of what we call neglected tropical diseases. So trachoma, lymphatic filariasis, onchocerciasis, selected local governments. We also administered this treatment. And what we found was that it was well taken. The fact that, the children can get an intervention, the adults can get an intervention in the household, and it was a bit more reflective of the breadth of needs of the communities. That was one reason. The second reason why the government of President Tinubu made a decision to go integrated is because you get efficiency that way. Okay. The same health workers that are in the primary health centers, they also have a role in these campaigns. And when we have many different campaigns, every other month you have one campaign or the other, you're drawing them out of the facility. So combining it, even though it took slightly more number of days, what that allowed us to be able to do is do multiple campaigns at the same time, so we don't have to do as many campaigns. The drain on the mothers as well. Don't forget that when you go into a community and you're coming around to vaccinate children, the caregivers have to leave what they are doing to be available or to go to the vaccination post. So also being considerate of, trying to minimize the number of times that mothers and caregivers have to do this. Those are some of the reasons why we decided to have an integrated campaign.
Okay, now you talked about 106 million children as a target for this campaign. How far have you gone? Have you been able to meet that target?
So the 106 million children for the measles rubella in particular is all of the 36 states and the FCT. Okay. This campaign is in two phases because we wanted to try to do a good job, and to do that you need good supervision, you need good coordination. We did it in two phases. So the first phase is 20 states, so all of the 19 northern states and Oyo State, plus the Federal Capital Territory. So it's sort of 20 states and the FCT. And in those ones, we were able to reach 59.4 million children, which is 92%, over 92% of the targets that we had for those states. Now, when we do the rest of the states in January and February is when we can then say nationally, this is the coverage we have achieved and this is how we have done against the 106 million children.
So the measles and rubella vaccine we're talking about now, is it different from the normal measles that children get at 9 months?
Yes, it adds another antigen. So the measles component is the same as the measles vaccine, but rubella is another disease that is similar to measles, but is unique in that it's very costly if it affects a pregnant woman, for example. That's why we give young people so that they are immune before they get to the age of pregnancy. They have children sometimes with what we call congenital rubella syndrome, brain damage, deafness, blindness, heart disease. Those are very costly, to manage if you even manage to keep the baby alive. So to prevent that, that's why the government decided to use the vaccine that also protects against rubella in our children.
Now, let's talk about immunization coverage nationwide. What's our statistics as of today?
So, the way we measure immunization is sort of there are routine immunization and there are campaigns. So for the routine immunization, we have indicators that we track periodically through a global mechanism called the Demographic Health Survey. So the Penta-3, the proportion of our children that have received the third dose of the pentavalent vaccine, it has 5 antigens in it. Is a standard measure that we use to assess our routine immunization. As of 2023, when the last NDHS was conducted, the number was at 53%. It has kind of stagnated over the last 10 years. This survey is done every 5 years. That's not good enough. It's a slight increase from the 50% in the previous one, but that's still almost half of our children that are not getting the routine vaccines that they should get, which is why the President Bola Tinubu said that's not good enough. You need to do better. So under the leadership of the coordinating minister, Mohammed Ali Pati, what we're doing is, one, strengthening the routine system so that the ability of people in communities to go to primary health centers and get vaccinated against all of the vaccines. So making sure that we're investing in buying the vaccines, we're investing in the cold chain infrastructure and visibility so that we know from here where we are running short of stock so that we can refill so that people need the vaccine, and then working with our communities through the gatekeepers, the traditional leaders, through you all in the media to mobilize people to go and get it. Now, because there is already a gap, that is in fact why you see we are doing campaigns for critical antigens. Measles is a very important disease. Rubella is a very important disease. Polio is a very important disease. That's why you see us doing specific campaigns to target these ones to try to bridge the immunity gap. If half of the children have missed over the last, couple of years, you can imagine that if we are waiting for all of them to go to the facility, some of them will even go outside the age that we routinely target, and they have been missed. That's why we are going to the communities to try to reach these missed children.
Now, you talked about Penta-3 recording 53% as of 2023, and you also went further to say that figure, it's not good enough. And then we also see where we have zero-dose children, So what strategy is your agency using to ensure that children in hard-to-reach areas get these vaccines?
Yes, what is interesting in our case is that the assumption that you would ordinarily make is that it's only children in hard-to-reach areas that will miss vaccines. Unfortunately, because of certain things that we're facing in terms of misinformation and pushback against vaccines, that's not even always true. You find people in relatively easy-to-reach, safe areas that still continue to push back on vaccines. A lot of progress is being made in that direction. But yes, Nigeria does have a disproportionate number of children that are termed zero dose, which means, at a high level, they have not received any of the vaccines that you expect them to get. The official definition is that the first dose of the penta vaccine is how you use to measure this. And what we are doing is we have mapped all of the locations that have a substantial number of zero-dose children, and then we're having community-specific interventions. We have something called identify, enumerate, and vaccinate. What this really is saying, what we're trying to say here is, look, these babies are not ghosts. They are people's children. They're human beings. You can see them. So can we go and find them? When we find them, document them, register them, make a list. You know where they live, you know who the mother is, you know who the father is, you know who the neighbors are and the communities. And then you try to understand what is the barrier to this particular child. So it's not a one scalp fits all, it's a customized approach. For some people, we just have never reached them with the vaccine, so it's a supply side failure. For many of them, they have wrong information. For many of them, they have other grouses against vaccines. For some of them, they even want it, but they have the wherewithal to go to the facility to get it. So the solutions are different. So what we are doing now is taking it child by child and actually going to say, what is your own reason? Parents, why is this child not vaccinated? And trying to work with the family and the community to address that issue. And we are continuing to inch into the zero dose as part of the measles rubella campaign. For example, in the first phase that I said, the 20 states and the FCT, almost 400,000, about 380,000 zero dose children were reached with routine vaccines, because we also gave, outside the campaign vaccines, we also gave routine vaccines to children who needed to receive them.
So children who have missed vaccine, is it possible to give them?
Yes. In
So
fact,
a child who missed the vaccine maybe at 0 to 1 year, for example?
yes. In fact,
Can the child make it?
so there are two things that the government has been up to. We are doing something called the Big Catch-Up.
Okay.
And what the Big Catch-Up is kind of a campaign to address exactly that. Is that if you are a child and you have your child that's outgrown the age that they would normally fall, which is, about 18 months, 15, 18 months is when they would grow out of the routine schedule. But they have missed critical vaccines. There's still an opportunity through the Big Catch-Up, to reach them. And we have done 2 cycles now. We're going to be doing another one. But nonetheless, I think if a parent knows that I have missed vaccines in the age that I should get it, but I want to get it for my child now, I think they can still go to the facility and have a conversation with the health workers.
Well, how are you coping with misinformation?
Oh boy. So that is a major issue. Just this morning, one of our respected, revered traditional leaders, an emir in the north, forwarded me something to say, this is another one, ED. And I said, yes, we're contending with it. It's a world now where people don't necessarily look to their health workers for information anymore. People look on the internet for influencers and people who just say anything. And there's freedom of speech on the internet. You can say whatever you want. A lot of it is unverified. People also don't necessarily have the ability or wherewithal or the interest to dig into the facts on things. So it's a major issue. What we try to do is a number of things, but I think I have suggestions of where you all in the media can also help. Is that, look, the average person may not know to verify information that is coming to them, or to even know where to verify from, So they worry, they believe, they ask questions. We try to combat this. We try to put out the correct information to counter this. You understand? But you can't keep up when this is coming from. You will know that most of the misinformation is not even generated locally. It's generated internationally. People are using artificial intelligence tools to make up things and make up lies and even make it seem like people are saying something. People that are respected figures, are saying things, So this is where we also need help from the media and communications community, advocacy and communications, to identify and tackle many of these for us. I think that's very important. I do think, the ability to debunk at scale You know, these rumors really is uniquely positioned with the media. When you come across information or when people ask you questions, ask us. If you are not sure, we will give you the facts. You know, we're not saying, we don't try to deceive people that everything is perfect, but at least let people make choices that are based on truth and evidence. You know, when vaccines are not safe, the government will not give them to Nigerians. You know, they say one person is interested in reducing fertility. There are family planning commodities and fertility control interventions that we have also made available to young people and women so that they can make a decision. There are tools that are for that. Vaccines are not the tools for that. So you get what I'm saying? And you don't hide it. It's a choice. People can decide. I think it's a virtue when you support women and young ladies and young people to make their own decision of when they are ready to get pregnant or have a baby. I think that's empowering, you know, because we know that it can be very costly in terms of education, in terms of livelihood for young people. So I think it's a collective effort. All of us have a role in tackling this issue of misinformation. There really is an infodemic going on right now. It's not just for vaccines, but for many things, you know. And I think all hands just need to be on deck to address it as much as we can.
Do we have enough vaccines in Nigeria? Are we short of vaccines in Nigeria?
We're not. You see, we have the fortune that our leader, the president, and of course his lieutenants, the ministers, coordinating minister of state for health, and those of us that are running the agencies, prioritize health promotion, prevention, and treatment of illnesses, which is our job, right? So, in fact, just a couple of weeks ago, the president had approved, and we released 68 billion naira as part of to go to UNICEF, our partners who procure some of these vaccines, because we don't currently manufacture locally, right? And the idea is that there's a co-financing that the government pays to some of our partners that also support us. So, you know, we were able to step up and fulfill, at least in part, these are co-financing obligations. So with that focus, with that kind of investment, even in the current environment, I think, and also being intelligent with how we apply the resources, you know, we are not short of vaccines. Now, they cost money. Even though it's free, it's important to state this. Even though when you go to a facility to get vaccinated, at least a public facility, you don't pay. So it seems free to you. But it's important to know that your government is paying for it. You know, partners are supporting us with resources. So they're not free, they're valuable tools. So we encourage Nigerians to not waste them. We have had instances in the past where local vaccinators just misuse or misapply or waste the vaccines. Nigerians need to know that this is your money, this is your commonwealth. So when your neighbor, if people reject vaccines or don't want to bring it back, we can use it for other people or go back and reuse it. But when people dump vaccines or throw them away, that is the wealth of the people that money from the government has bought and from our partners that were thrown away. So I think it's very important that Nigerians understand that.
But I know during the COVID-19 there was this push for local vaccine production in Nigeria. It was really a wide talk about issue. How far have we gone? Are we still in that line of production?
We're making progress. So what COVID-19 did was to bring to the fore the need to start to take control of our health commodity supply chain, not just vaccines, right? Because you know that when all is well and good, yes, we're all brothers and sisters. But when problem starts, you're basically on your own, I'm on my own, at least from a country perspective. That is what COVID-19 showed us. So we started to really talk about it, but I think it was not until President Tinubu's government that a deliberate set of efforts were taken. So as part of the health sector blueprint, a whole pillar out of 4 is dedicated to basically jump-starting the value chain in health. So local production of our commodities, pooled procurement that improves pricing and efficiency, for government and our partners through pooled procurement. So one of the core products that we're really driving, there's in fact an initiative that the president established. He appointed a national coordinator, Dr. Abdul Mukhtar, who's leading that, where now a lot of manufacturers are springing up of drugs, of simple devices, and in one or two instances moving towards the production of vaccines. The thing about vaccine manufacturing, which we did before actually, we did before many years ago, rabies vaccine, yellow fever vaccine in Lagos, and we're talking about how to rejuvenate that. The technologies have moved, they have become more advanced, but you see, it's not on or off. It's not like manufacturing shoes or leather bags. These are very delicate, very refined products, so the capabilities and the technology is quite advanced. So it's taking time and resources. More often than not, you have to actually have partnerships with established manufacturers elsewhere who are willing to come and manufacture and create the jobs locally and transfer the technology to us. That's the approach that we're taking. And again, we're also thinking regionally. You can't have every country producing every vaccine. The cost, the investments to produce, to invest in manufacturing, you have to recoup it for this to be sustainable so it doesn't die. So we are thinking of a regional market. When you put the population of West Africa, for example, or the whole of sub-Saharan Africa, that's a bigger target. So Nigeria will manufacture some vaccines as part of our regional trade agreements. Other countries will manufacture other vaccines, and we will cross-sell on the African continent.
The HPV vaccine that was launched few months ago, or I think about last year or thereabout. How far has it gone? That's one. We talk about cancers, and we always say cancers have no cure, but this is one cancer that is highly preventable.
Yes.
How far has it gone?
So we have now vaccinated over 15.5 million young girls across the country. The HPV vaccination program was flagged off by the First Lady of the country, Senator Oluremi Tinubu, in October of 2023. So we went through 2 phases of a campaign rollout, similar to what we're doing with measles rubella. We first did a set of states, then we went to the rest of the states, around the middle of 2024. And we have reached and surpassed our own targets. And in fact, the number of people that have been reached with this vaccine has been so impressive that it's widely talked about around the world to say, what Nigeria has been able to do with this campaign against cervical cancer. Again, I think you're right. Cancers are a scourge that I think we're all familiar with. There are not many of them at this time that you have a verifiable tool that is very effective. The HPV vaccine is effective to prevent 99% of the serotypes, cases from the serotypes that are prevalent among our people. So that's an incredibly effective tool. So our responsibility is to do what we can. So the government is buying these vaccines, is making it available. We, the operators, are doing our best to make sure that it gets to the front line in a potent state, in a way that it can still work. It's good quality, and that it is delivered to our girls.
Let me give you just a moment for you to speak to Nigerians, to parents, caregivers, on the importance of vaccine.
Thank you very much for this opportunity. I think I just want to call on Nigerians that vaccines still remain today the most cost-effective public health tool. When you look at the disease that is prevented, the deaths that are averted, when you weigh that against the mild side effects that you might get, the cost of the vaccines, they are very valuable. Most of the vaccines target children, and adolescents. These young people are given to us by God, and they depend on us as parents to make decisions for them. So let us make sure that we fulfill the obligation as a caregiver, as a parent, to make the right decisions and avail your children of these tools that will protect them against very debilitating, sometimes life-altering diseases. We all have seen cases of children that have polio, that are paralyzed, and they cannot walk. That changes what they are able to do in their lives. Many children that are not vaccinated will get measles, some of them will die, some will get rubella, some of them will have brain damage, will become deaf, will become blind. That does not allow them to live optimal lives. So I think as parents, we need to be very careful in the decisions that we make. There is a lot of information that is out there. We ask that it's okay to have questions. When you have a question about any vaccine, there are many ways you can verify. There's a toll-free number 7722 that you can call that is operated by the National Primary Healthcare Development Agencies. There are other social media handles that are verified by health authorities that can answer your questions. When you get information on social media, don't believe what you put there. You know, I tell people that how many of us put the truth about our lives on social media? Everybody puts what they want people to see. So why would you believe what somebody just puts out there without checking? So check with those who know. Verify the information with your health workers, with your more informed people, and call the government agencies. The government has a responsibility, you know, towards its citizens. 7722 is the number. Thank you.
Thank you so much. I have been speaking with the Executive Director of the National Primary Healthcare Development Agency, Dr. Mui Aino. Immunization is one of the safest and most effective ways to safeguard our children's future. Parents, caregivers, health workers, and community leaders, it is our collective responsibility to ensure that no child is left behind. And thank you so much for being a part of today's edition of Health Digest. I'm Ogom. Do stay safe.